So commercial labs are struggling to keep up with the increased demand for more coronavirus testing. Many states have increased their testing throughout the entire state. Meanwhile, there's a backlog. There are tens of thousands of tests that have already been conducted, and people are waiting for the results. And hospitals say that this is wasting precious resources. Jericka Duncan has more on that.
I think you want to know what's going on with your body, and then what you might be facing, further ahead.
Mike Hoffer says he was left without answers for 8 days after taking a COVID-19 test.
You're in this constant worry of, is he going to wake up in the morning? Is he going to wake up in the middle of the night gasping for air?
His wife Lisa said the lack of information also left friends and family wondering if they were exposed in the meantime.
Not only can we not get answers, but we can't give answers to our employers, to our friends, to our family, people that we had been around in the couple weeks before.
Mike's test was administered by his local urgent care. But even national groups like LabCorp are reporting turnaround times of 4 to 5 days. And Quest Diagnostics tells CBS This Morning it is still working to clear 80,000 tests from its backlog. That's down from 160,000 tests nearly 2 weeks ago.
Should the private laboratories be doing more?
I think everybody needs to be doing more. And private labs are a part of the solution. My sense is that they are working as hard as they can.
Dr. Ashish Jha is the director of the Harvard Global Health Institute.
Without testing, you don't know how much disease there is. You can't isolate people who are infected. You can't make treatment plans for people who are infected.
Hospital officials say testing also helps them manage resources like bed availability and personal protective equipment, or PPE.
When it comes down to lab testing, turnaround time is PPE.
Dr. Jeff Baird is the acting chair of laboratory medicine at UW Medicine in Seattle. He says the hospital's in-house testing can process results within hours, which helps them save valuable resources.
For the hospitalized patient or the patient evaluated in an emergency room or a clinic, we need to treat all of those patients when they come in as if they had it, because if they do, we need to be protected. And if they don't, we can then relax our PPE standards and treat them in a more appropriate way.
But it's not just private companies struggling to keep up. As of Sunday, more than 14,000 people in California are awaiting test results from both private and public health labs. Many other states have yet to report specific numbers on testing backlogs. Inconsistencies between states inspired the COVID Tracking Project, which collects all the data state by state in one place. Alexis Madrigal, a writer for The Atlantic, is a co-founder.
We feel like if you're part of the national response to this epidemic, then you owe the nation transparency. What we need from them is not perfection, but transparency, honesty, and openness.
All right, let's bring in Jericka Duncan now to talk about this. So Jericka, clearly it looks like we have a lot of work to do when it comes to getting the results of these tests. What are commercial labs saying about the backlog?
Well, they're saying that they have increased their testing capacity. And I think when you look back at these two main companies that we looked at with Quest and LabCorp, which total right now have performed over 1 million tests, they were sort of the first ones out the gate. That first week in March 5th, March 9th is when those companies started testing. And I think there was such an influx that they didn't realize the amount of testing material that it was going to take, and that they, in fact, weren't going to be able to perform all these tests within those, 5 to 7 days that they were saying in the beginning. Then it's now 4 to 5 days on average to get the results. But after this story first aired on CBS This Morning, I've received a few tweets from people saying, my results took 2 weeks. Someone said their results took 3 weeks. I have a close friend of mine whose sister, she said, is still waiting for her results. So you're going to find places and people all across this country who are waiting for the results. And the problem with that is twofold. It's peace of mind and not knowing, because you could then be spreading it or infecting other people, or you start to question who I may have been in contact with. And then, of course, the more knowledge we know about who's infected, the better we can treat it. Although many doctors will tell you that the treatment plan doesn't change. Even when people are positive for COVID-19, a doctor generally will tell you to stay home and self-quarantine Of course, unless you're having respiratory problems. I personally have experience with that. I was not able to get a test, but I know that due to the shortage of tests, they're telling people, of course, to go home and quarantine, especially here in New York City. But they are getting a handle on the backlog. I think it was just a matter, again, of in the beginning not realizing just how many tests that they were going to be expected to perform in a short amount of time.
So, Jericka, what about the gentleman in the beginning of your story, Micah Hoffer? Did he ever actually get his results?
That's a great question. He did get his results, and he tested negative. But a day after getting the results, his symptoms got worse. He had a tough time breathing. He actually went to the hospital, and then they decided to test him there again, and he tested positive. So that becomes a separate story of people who get a test, and in fact, they do have coronavirus, but maybe it's a false negative test. So I'm sure we'll be, looking into that more. But he did test negative on that first one, and again, went back to get treatment. The hospital tested him, and he did, in fact, have coronavirus. But as you saw in the piece, he's doing much better now.
And what was his family's reaction once they got the test back? Sorry, Emery.
Say that again, Vlad. That's okay.
Sorry, there's a delay. I just wanted to know what his family had to say about the results of the test when they got that back.
Well, at first, it was sort of a relief. Again, it's that idea of a peace of mind. But then it's like you have to listen to your body and pay attention to those symptoms that we keep hearing about. And then, of course, to find out that your relative does, in fact, have coronavirus, well, then everyone in the family who's been in contact with him and his immediate family was naturally concerned. As far as we know, everyone is fine right now. But then, what's so tricky about coronavirus is you could not show symptoms for days at a time, or you could have someone in your household that does have symptoms and other people do have symptoms, or they don't have symptoms, and then you have symptoms. So I think it just depends. But the family's doing well. But without a doubt, it was frustrating for them in the beginning to not know, then to find out, only to find out that, in fact, Mr. Hoffer did have coronavirus.
I hope you get an opportunity to sort of follow up on that second story that you were talking about, which is this, false negative, or maybe when he tested weeks and weeks ago, he didn't have it, but in the meantime, he picked it up. I think that's a really, really interesting story. I can't imagine how nerve-wracking it is for his family. Jericka, thank you so much for talking with us.
Yeah, it's one we're working on, so stay tuned.
Good.